The new guest experience.
Hi, welcome to Ideal Dental.
Hi, I'm Dustin.
Hi Dustin, I'm Mary. Have you filled out your patient forms yet?
Oh, not yet.
Okay, let me get that for you. If you would take a few minutes to fill these forms out, and then while you do that, can I make a quick copy of your driver's license and insurance?
Of course.
Thank you, and I'll bring these right out to you.
All right, thank you.
Thank you.
Dustin?
Hi.
Hi, nice to meet you. My name is Karen. I'm going to get you started today. I'm going to be the assistant.
All right.
Nice to meet you. Come on back. How did you hear about our office?
I heard about it online.
The dental assistant will bring back the new guest, giving a brief tour of the office, pointing out the location of the restroom, how many operatories the office is equipped with, and which room they will be in today for their appointment.
Dustin, I'm going to take a panoramic x-ray. Do you have anything removable in your mouth?
I have no idea.
Okay. Any medical conditions that would keep us from taking this x-ray?
No.
Fantastic. All right. I'm going to get you covered up with my apron and walk you into the machine.
Remember to ask to remove any removable appliances in the mouth, jewelry from the neck up, and ask if there are any medical conditions that would prevent x-rays.
So we're going to go into operatory number 1. If you'd like to have a seat in the center chair for me.
Okay.
So what brings you to see us today, Dustin?
I just came in for my 6 months cleaning.
Okay. Anything hurting or bothering you, or any areas of concern?
Actually, my upper left side has been hurting.
Okay. Is it heat and cold sensitive to bite?
It is. It is
Okay.
heat cold sensitive.
How long has it been bothering you?
It's been bothering me for about past few months, on and off.
Okay. Well, great. Well, I'm going to start by getting your blood pressure. I'm going to get you covered up and take some x-rays, okay?
Okay.
If you don't mind, I'm going to have you lift your sleeve up just a little bit for me.
The dental assistant will record the vitals on the power pass and on the patient's chart.
Okay, great. Blood pressure is 112/70. It's also 69. I'm going to get you covered up and take some x-rays, okay?
Okay.
All right, I'm going to go ahead and get the apron on you. Thank you.
The dental assistant will take a series of x-rays which usually consist of 4 bite wings, possibly more if there are areas of concern or if the doctor requested additional x-rays.
I'm going to get you uncovered and I'm going to take some intraoral photos, okay? Do you have any sensitivity to air or cold on any of your teeth?
Only on the teeth in my upper left area.
Now the dental assistant will capture a series of intraorals, grabbing the occlusal surface of each individual molar, the occlusal surface of individual or paired premolars, and the incisal edge of the anterior teeth. Bite shots will also need to be taken, and any additional intraoral images may be taken on the buccal or lingual of any tooth.
Alright, you can go ahead and close. Let me stitch you up. And move the pictures over to the TV and show you your x-rays, okay?
Okay.
Okay, Dustin, I'm going to go ahead and go over the x-rays and the pictures that we took. This is the area of concern that I have and that you also came in with. So I'm going to go confer with the doctor and he'll come in and take a look at it. More than likely, it's a possibility that you may hear words like root canal or crown. He may want to do that process for you to fix that so we can save that tooth for you. Do you have any questions for me?
What exactly is a root canal?
So a root canal, what the doctor would do is he would go in and he would clean out the decay and they would disinfect the tooth, they would remove the root surface and then put in a filler, and then we would cover the rest of that tooth surface with a full coverage crown for you. We do warranty all of the work that we do, which is another wonderful thing with our practice. We warranty our crowns for 5 years. Well, let me go get doctor and we will come in and I'll go over everything with him and then we'll do your exam, okay?
All right, thank you.
You're welcome.
Before you leave, make sure the TV is set to show the computer prior to the doctor entering the room.
Hey, Doc.
Hi.
I have Dustin in op 1. He's a new guest with us today. And he has not been seen in about 1.5 years, but he, on his upper left side, number 15, has got a pretty good size hole in it. Looks like we might have some decay, needing a root canal and a crown possibly. So I wanted to see if we were ready for an exam.
Okay, let's take a look. The doctor will now perform the exam, calling out proposed treatment and identifying the main concern, also known as Phase 1. At this point, the doctor has completed the exam and has now begun educating the guest on his findings. The dental assistant has left the room and is now charting the recommended treatment and phasing it out.
Hi, Dustin.
Hi.
How's everything going?
It's been going pretty well.
Oh, good. I'm glad to hear they've been taking great care of you. Do you have any questions about your treatment before I go over your treatment plan with you?
A clinical member should always be on standby when the front office is presenting treatment to answer any clinical questions that may arise.
Not in particular, other than how much is it going to cost me and how long is it going to take me?
Is there a certain time that you need to leave by today?
Preferably between 30 minutes to an hour.
Okay, we should be able to accommodate that. I'll double check with the doctor though before we get started. In terms of your treatment, so for that root canal on your upper left side, we will start the root canal today and then prep your tooth for a crown. So with your insurance portion, then this would be your copay for today's services. Okay, and how would you like to take care of that?
Credit card.
Great, okay. If I could get that from you, I'll get your checkout started, and then that way when you're done here, you'll be good to go.
All right.
Perfect, thank you.
The Power Pass must be completely filled out prior to walking the guest up front for checkout.
All right, Dustin, I'm going to have you come right over here to the checkout desk with me. I'm going to walk over to Miss Mary. All right, Mary, I have Dustin here. So he was here today as a new guest. We did 4 bite wings, 5 PAs, 1 pano. We also did prep tooth number 15. We started a root canal today and prep for a crown. So we'll need to see him back in about 3 weeks to finish that root canal and seat that crown for him. We did also discuss Invisalign with him. So when you come back, we'd love to impress for that Invisalign for you. We did not get his cleaning done today, so we could also do that the day we seat if that's possible. Was there anyone else that we needed to get scheduled for you today?
Oh yeah, could we also schedule my kid to come in at the same time that I do?
Of course.
Fabulous. And then we would love for you to go online and do a review. You can either use Yelp or Google. We would love to know how we did today. It helps us kind of gear and figure out, make sure we're doing everything okay.
Absolutely.
Did you have any other questions for me about any of the treatment that we did today?
I do not.
Fantastic. It was a pleasure working with you today. I look forward to seeing you soon.
All right, thank you.
How'd everything go today, Dustin?
It went really well.
Good. Okay, so let's get those next appointments set.
The first 15 minutes of a patient's appointment will be with the dental assistant. The dental assistant will begin with pulling the guest back and giving a brief tour of the office, ending in the panel room. The dental assistant will then grab a panel and seat the guest in their assigned room. Once the dental assistant places the bib on the guest, they will begin taking their blood pressure and record it on both the Power Pass and the patient's digital notes in EagleSoft. The next step is asking the patient if they have any areas of concern, pain, or discomfort before they take any x-rays or intraorals. That way, all needed x-rays and images can be grabbed at once. Once the chief concern has been identified, the dental assistant should educate the guest with the intraorals on possible treatment the doctor may recommend. Lastly, the dental assistant will prep the doctor for a successful exam by giving a brief overview of chief concerns and any other information of importance.
Okay, so we've got that set. Here is your receipts from today, as well as your treatment plan and the information about the Invisalign. And then there's also some information on how to leave a review for us. We would love for you to tell us how your visit went today online.
Oh, absolutely.
Thanks, Dustin. It was a pleasure to meet you.
All right, thank you.
Enjoy the rest of your day.
You too.
Thank you.